You're watching CTOM TV. Knowledge is power.
So the KRAS mutation, this is tested for in lung cancers. And typically you'll have a variety of different mutations that will be tested for. Typically, KRAS mutations have been undruggable. We haven't been able to develop a drug to target KRAS mutations for a variety of reasons. I won't get into that because it gets very complicated very quickly. But there is one specific mutation that we now have called the KRAS G12C. And how that works is the gene name is first. So KRAS is the name of the gene. And then the amino acid that is supposed to be at that position, at the 12th position, is called the G, the guanine. And in this particular case, it's been altered to a C. So the mutation that you're supposed to have is first, then the number of where this mutation occurs in the gene is next, and then the new amino acid that is replacing the original one is the last thing. So a G is being replaced at the 12th position by a C. So there's a new drug called sotorasib. I think that's how you pronounce it. So this drug is very new, but it's actually quite effective in KRAS G12C mutations. And they're using it right now in clinical trials for both lung cancers and for other cancers like colon cancers and so on. So in KRAS, or in lung cancers, typically KRAS has been a huge driver. It's also a common mutation in many, many cancers. But in lung cancers, it's used to determine a type of lung cancer and can rule out certain treatments and so on. And it can be a prognostic indicator. However, we like to use KRAS mutations to track disease. And the reason we can do this is because KRAS mutations are one of the first mutations that occur when a normal lung cell, starts getting converted into a tumor cell. That process is called transformation, oncogenic transformation. And what happens is a series of mutations happen over time based on exposure to carcinogens. And these mutations build up. And then once you have a certain threshold of mutations, humans, you have to have mutations in 4 separate pathways before a cell can be a cancer. In mice, it's actually 3. They have what's called an active telomerase gene. But in humans, you have to have at least 4 mutations in order to transform a normal cell into a tumor cell. So the KRAS is one of the first mutations that happens. And so because of that, we know that this KRAS mutation is going to be in the vast majority of the tumor cells. And therefore, if we used a blood-based liquid biopsy, we can measure the amount of this KRAS mutation that a person has and say, you know, yes, you have a lot of tumors in your body or cancer cells in your body, or yes, your body is responding to treatment or not. So we'll talk more about that later, but I just wanted to mention that KRAS is a valuable mutation because we can use it to track, how a patient is responding to treatments.
Thank you for watching CTOM TV. Subscribe below and stay informed.